first thing you want to do is make sure that the protocols you're using in the office are ones that are going to be properly diagnostic and effective. Let's take the tongue tie example first, because that's the most important one. The first thing you want to do is you want to make sure your child actually has a tongue tie, and they should be assessed by a qualified myofunctional therapist. It's a functional diagnosis. They're going to have the child swallow, take various measurements about how the tongue moves, and after seeing if it's not quite functioning the right way, they'll give exercises. And when they see that it's clear that the tongue can't function in the right way because the tie is restrictive, they will diagnose them with a tongue tie. And at that point in time, certainly they should get a tongue tie release. I'm a very big advocate of Dr. Zaghi at the Breathe Center. His protocol, I love CO2 lasers compared to diode lasers and electrosurgical instruments. They're much more selective for the tissue that we need to release, and they produce a lot less pain, and they produce a lot less scar tissue afterwards. Afterwards, you need to make sure that the practice you're seeing understands that the tongue tie release procedure is not where it stops, that the patient needs to go back to the myofunctional therapist. They need to do the exercises that the therapist recommends afterwards so that the tongue tie release is successful. There also can be another consideration. Oftentimes there's not enough room in the mouth to really actually effectively fit the tongue up in the palate. It may be that the therapist recommends an expander to get more room in the mouth. And you need to see a practice that understands all these issues. You need to understand how the myofunctional therapy and the releases and the expanders are all a part of the facial development that is getting the mouth to be the right size and shape, and that all the function in and around the mouth is correct. Those are really truly addressing the root causes of the problems. Otherwise, you're not going to correct things like sleep apnea, mouth breathing, teeth clenching. You're just going to get a tongue tie release. Or if you just get an expander, you're just going to get a bigger mouth, and that's it. When it comes to cheek ties, it's very important to diagnose cheek ties. Muscles that are on the outer part of the face, they can be very retractive and restrictive. The tongue muscle in the mouth, it's the only muscle that pushes out, so that can be thought of as our natural expander. Even if that's working perfectly for us, or you get the world's best expander, if there's really strong like lip ties and cheek ties, they can be very, like lip ties will pull back, and the cheek ties can be very compressive. That's going to restrict our facial growth. These are some of the structural considerations that need to be looked at.